Ever had one of those days where your head just won't stop pounding, like there's a tiny drummer inside your skull who refuses to take a break? You're not alone. Headaches are one of the most common health problems in the world, and almost everyone experiences them at some point. But what exactly is a headache? Why does it happen? And more importantly, how can you get relief quickly? Let's dive deep inside the human body and understand what's really going on. First, here's something surprising. Your brain itself doesn't actually feel pain. That's right. The pain you experience during a headache comes from surrounding structures like blood vessels, nerves, muscles, and tissues in your head and neck. When these areas get irritated, inflamed, or stressed, they send pain signals to your brain, and that's when you feel that familiar ache. Now, not all headaches are the same. There are different types, and each one feels a little different and has its own causes. Most common type is the tension headache. This is the kind most people experience. It usually feels like a tight band wrapped around your head, creating a dull, constant pressure. Tension headaches are often caused by stress, poor posture, long screen time, or even lack of sleep. If you've been staring at your phone or laptop all day, chances are you've felt this one. Then comes the migraine, which is much more intense and can be truly disabling. A migraine isn't just a headache, it's a neurological condition. People with migraines often experience throbbing pain on one side of the head, along with nausea, sensitivity to light and sound, and sometimes even visual disturbances like flashing lights or blind spots. Migraines can last for hours or even days, making it difficult to carry out daily activities. Another type is the cluster headache, which is less common but extremely painful. It usually occurs in cycles or clusters, often waking people up in the middle of the night with intense burning or piercing pain around one eye. These headaches can happen multiple times a day over weeks or months. There are also sinus headaches, which happen when your sinuses become inflamed, usually due to an infection or allergies. This type of headache causes pressure around your forehead, eyes, and cheeks, and it often gets worse when you bend forward. So what actually causes these headaches? There isn't just one answer. Headaches can be triggered by a wide range of factors. Stress is one of the biggest culprits. When you're stressed, your muscles tighten, especially around your neck and shoulders, leading to tension headaches. Dehydration is another common cause. Your brain depends on proper fluid balance, and even mild dehydration can trigger pain. Lack of sleep or irregular sleep patterns can also lead to headaches. Your body needs rest to function properly, and when you don't get enough, it can affect your brain chemistry. On the flip side, too much sleep can also trigger headaches in some people. Diet plays a role too. Skipping meals, low blood sugar, or consuming certain foods like caffeine, chocolate, or processed items can trigger headaches in sensitive individuals. Even strong smells, bright lights, loud noises, and weather changes can act as triggers. Hormonal changes are another important factor, especially for women. Fluctuations in hormones during menstruation, pregnancy, or menopause can lead to headaches or migraines. Now let's talk about relief, because that's what everyone really wants. The good news is that many headaches can be managed or even prevented with simple lifestyle changes and easy remedies. One of the easiest and most effective tips is to stay hydrated. Drinking enough water throughout the day can prevent dehydration-related headaches. If you feel a headache coming on, try drinking a glass of water and see if it improves. Rest is another powerful remedy. If possible, lie down in a quiet, dark room and close your eyes. This is especially helpful for migraines, where light and noise can make symptoms worse. Applying a cold or warm compress can also provide relief. A cold pack on your forehead can help reduce inflammation and numb the pain, while a warm compress on your neck or shoulders can relax tense muscles. Gentle massage can work wonders too. Massaging your temples, neck, or shoulders improves blood flow and reduces tension. Even a few minutes can make a noticeable difference. If your headache is caused by stress, relaxation techniques like deep breathing, meditation, or even a short walk can help calm your mind and body. Reducing screen time and maintaining good posture can also prevent tension headaches. For migraines, identifying your triggers is key. Keep track of what you eat, your sleep patterns, and your environment to figure out what might be causing your attacks. Once you know your triggers, you can take steps to avoid them. Over-the-counter pain relievers can help, but they should be used carefully and not too frequently, as overuse can actually lead to more headaches. And finally, If your headaches are severe, frequent, or unusual, it's important to consult a healthcare professional. Sometimes headaches can be a sign of an underlying condition that needs proper treatment. So the next time your head starts to ache, remember, your body is trying to tell you something. Whether it's stress, dehydration, lack of sleep, or something else, understanding the cause is the first step toward relief. Take care of your body, listen to its signals, and give it the rest and support it needs. Because inside the human body, everything is connected, and even something as common as a headache has a story worth understanding.